I'm Brenda Latham Sadler. I'm an associate professor of family and community medicine at Wake Forest School of Medicine, Wake Forest Baptist Medical Center. I also serve as the Associate Dean for Student Inclusion and Diversity, but I'm a family doctor. I'm a physician. I think of myself as a country doctor because I grew up in the South, in rural South Carolina. So my heart is with working with people in primary care. So we have to build trust by first being welcoming to everyone, showing that we care about them. And then we have to listen to them. When my patient tells me something, I have to sometimes stop myself from going to immediately to what doctors do. We are clicking and thinking and putting the pieces together. I have to sometimes put myself in timeout and say, wait, stop. What is this person really saying? Sometimes I have to ask the question 2 or 3 different ways to make sure I understand what it is they are trying to tell me. So you build trust by, I guess, being trustworthy, showing that you have the best interest of that person, showing that you really care about them, and being there when people need you. So when I'm seeing patients, I used to say, are you getting the vaccine? Lately, I started asking patients, when are you getting the vaccine? Because I don't want patients, first of all, to have an easy answer of, I'm not getting the vaccine. The other reason I do that is because I want to know what their thinking is without them processing it so much. And quite often my patients will say, I'm not getting the vaccine. And I used to say, well, these are all the reasons why you should get the vaccine. Now I say, tell me why you wouldn't get the vaccine. And it helps me to process their thinking around the vaccine. It helps me to gauge the level of knowledge about the vaccine. And it also helps me to understand their fears of this vaccine. And of course, I get the usual reasons. I don't know what's in it. I don't know what it's going to do. I don't trust it. They made it too fast. I don't get any vaccines. Occasionally, I'm allergic to all vaccines. So what I tell people about the vaccine is, number one, above everything, is the vaccine is safe. It is safe. And then I say, I've gotten both of my vaccines. All I had as a reaction was my arm was sore for a few days. And then I talked to them about the fact that the vaccine technology has been around for over a decade. Yes, it was prepared quickly, but that was because we had all of the technology, and we have these computers that can help us now to do things much quicker with assessing the data and testing the product. And then both of the vaccine producing companies had trials of over 70,000 people before this vaccine was rolled out to the community. That's a lot of people. Now, it is only approved for people at this point, age 16 and older, because we don't typically do tests on children. There was also, testing was not done on pregnant women. There, however, were women who became pregnant during the time that they were in the vaccine study. So they were able to gather data on them. So I will say that again, the vaccine is safe. The vaccine is safe. I can't say that enough. The vaccine is safe. I will tell you what happens to some people who've gotten the vaccine. There are 2 levels of reactions. There's a local reaction where some people get the swelling in their arm, some pain, soreness, easily treated, cool compresses, some Tylenol, ibuprofen after you've had the vaccine if needed. There's a generalized Some people are getting fevers. Some people are getting chills and fatigue and headache. Those symptoms last about 24 hours. I think that that's very mild compared to what they would have experienced had they gotten the virus itself. And there's a very, very small number of people who've actually had a reaction that we call anaphylaxis. That's a severe reaction where you might get swelling of the throat, swelling of the tongue, shortness of breath, trouble breathing, hives. Very, very small. Now, that is a serious reaction, but that could happen with any vaccine. That happens with bee stings. That happens with people who eat peanut butter. So this is not some weird new reaction just to this vaccine. This is something that happens to the human body when it comes into contact with something that it reacts to very violently. I don't know how many times I can say this, but the vaccine is safe. I've had mine. You should get yours. And if you're not sure still, there are so many resources for you to educate yourself. I tell my patients, come in with your questions. When you go see your doctor, have your list of questions. Ask questions to satisfy yourself, to know that you have the information that you need to make good decisions. Because often we make decisions without enough information, and usually those are not good decisions. But there is so much information out there. Now, if you don't have a computer, you can call your health department. I know you might have trouble getting through, but there are places that you can call. You can also go to cdc.gov, which is our Centers for Disease Control, North Carolina Department of Health and Human Services, that's ncdhhs.gov. Our own Wake Forest Baptist Health's Northwest AHAC at northwestahac.wakehealth.edu has information at all levels and answers to your questions. The frequently answered questions are on all of these websites. We also have an Office of Minority Health in North Carolina, the North Carolina Office of Minority Health. But NIH also has a national office of minority health that you can find information specifically for the community that you feel most comfortable. For those of us in North Carolina, there's also yourspot.yourshot.nc.gov. So that's a way to learn more about the vaccine, to find out where you can get the vaccine. We've also been doing a lot of presentations to church groups. The Maya Angelou Center for Health Equity has been doing an amazing job in all of our communities to make sure that people have the information that they need to make good decisions, to make the best decision.